16 years since Peter was diagnosed with HIV. In that time, the biggest change he's seen hasn't been because of his health, but because of the stigma from some of those around him. He says the last place he expected to experience it was in hospital at the hands of medical professionals.
Well, I was on the trolley and I was literally outside the doors to the operating theatre. So I was in the anaesthetist's room, and it was at that point I was told that I had to go back to the waiting area. I went back to the waiting area and I was told that because I was HIV, my operation would have to be done last because they needed to deep clean the theatre after my surgery. The surgeon came through to speak to me and he was really apologetic and just said, you know, he had no problem with doing the procedure. And it was just that he'd been overruled by the management there.
And how did that make you feel?
I was just shocked because I never expected a medical professional to be so uneducated in HIV and transmission. To be honest, I think that was the shock, you know, to have that happen in that environment. I broke down and I tried to go to the office in my gown and there was just nobody. Well, nobody was really sympathetic at all apart from the surgeon.
Peter's HIV medication means the virus is undetectable and that there is almost no chance it could be passed on to someone else. The Health Ombudsman has criticised the hospital, saying no extra cleaning is necessary after treating someone who's on HIV medication.
This case shows that discrimination still occurs in our National Health Service. Living with HIV is a continuing health issue, and therefore he should have been treated exactly the same as anyone else, because the regulations require that all the necessary clinical safeguards are taken for people living with HIV in comparison to any other illness. So to single him out in that way was entirely inappropriate, and it should not have happened.
Walsall Healthcare NHS Trust said, "We would like to sincerely apologise again to this patient for the ill-informed and inaccurate comment, and appreciate this would have been a highly distressing experience. The Trust has been working with staff across our hospital and community services to educate colleagues about universal infection prevention and control procedures."
I was diagnosed in 2007 and the stigma for me is still the same as it always was. I think it's important that hospitals in particular, given their knowledge of the condition, should be at the forefront of trying to break down the stigma around HIV. And when it goes wrong at a hospital, you know, there's something really wrong.
Since his apology, Peter has continued treatment at the hospital's HIV clinic, which he says is among the best in the country. For him, this was about making sure what happened on that day was a one-off. The hospital says changes have been made. Lewis Warner, ITV News, Walsall.